My name's Claire Louise Chapman, and I am a social value consultant. And our organisation is the Shared Value Business, which is a specialist social value consultancy, which I'll explain. And I'd just like to say thank you for joining us today. We've got I'm really quite excited about this, a really brilliant discussion to go on today. So I will introduce you to the other speakers. Just to let you know who's with us today and who will be speaking, and then we will get started with our session. So I'd just like to welcome Stuart Hoskindon, who is Head of Patient Flow and Resilience at Morecambe Bay NHS Foundation Trust. I have Neville Clokey, who is MD of Lancastle, which is an SME that's based in Lancaster. And I've got Michael Fraser and Paul Douglas, both of BAE Systems, who do exciting things like work on submarines, which is pretty exciting. So they're going to be speaking to us in a minute about a project called the Morecambe Bay Hood, which is very cool. But I thought that I would just do a quick introduction to the concept of kind of what do we actually mean by social innovation? Because today's talk is on that strand of social innovation. And there's a lot of discussion about what social innovation what it is, what it means at theoretical level, but we don't necessarily always see this so much on the ground. So, because business as normal tends to mean that people kind of work in silos, and it means that we stay within our own pools of expertise and familiarity, and we tend to know who we know and do what we do. And social innovation kind of turns that on its head, really. And the Morecambe Bay Hood Project is a real example of social innovation that works in practice to produce something which responded quickly to an urgent social need. And it's brilliant because not only is a fantastic piece of kit, but because in order to produce this bit of kit, three very different organisations had to come together and work out how to work with each other. And in many ways, this was the true challenge. And we'll be hearing about BAE, Lancastle and the NHS came together to create this and make this happen. But I'm just going to do a little bit of theory. So I'm a social value specialist. And it means that I help government organisations respond to new government legislation and methodology to embed social project delivery within commercial contract activity. So social value maximises the positive impact on people and planet, largely at a local level, by embedding socially and environmentally responsible practices into the way that business operates. So it's who you employ, how you train people, how you procure services and products locally and ethically. It's not an add-on, it's the way that you do business. And doing this creates high levels of what we call community wealth. So community wealth is about more than money, but at its heart, money is pretty fundamental. It's where this focus on buying locally and keeping money in a local economy is so important, because the add-on social impact is that local businesses tend to employ local people whose kids go to the local school, who shop locally and use local services. And this means that an area becomes quite vibrant. It becomes a place where people want to live and work, which is really important for our local communities. I also wanted to talk about the concept of shared value, and the clue is in our business name because it's the Shared Value Business, and why I'm particularly excited about today's conversation, and I am pretty excited about this. So shared value is the concept of businesses going a step further and actually basing elements of their business activity around creating products and services which respond to social or environmental need. So your business activity becomes focused on social innovation, which is the topic of this talk. So it's never going to replace the role of social enterprises or charities, because these tend to respond to areas of market failure. But we're seeing through these kind of practices this blurring, a good blurring of the distinction that companies exist to make money and charities support social good. And we're actually starting to move towards a society and communities where we don't have that kind of segregation anymore, but everybody understands the skills and expertise that they can bring to tackling these big societal and environmental challenges. So the Morecambe Bay Hood is this amazing example of shared value in practice. So without further ado, I'm going to introduce you to Stuart, who's going to explain and lead the discussion on how the project came to be. And Anne is going to share some slides. So I hope you enjoy the discussion.
Thanks, Anne. Next slide, please. Great, thanks. Oh. There we go. So I think it's probably crucial for this talk we set the framework really in terms of where this social network comes from. So pandemic wave one, if you like, hits us back in February of 2020. And actually it was a corridor conversation with one of our ward sisters. And as you can see there on the picture, we were challenged to buy curtain hooks. Now you might think, how on earth does a hospital suddenly become challenged by curtain hooks? But everybody at this point in time is now trying to find ways of having more disposable products in the hospitals because we're anticipating a huge surge of patients who have what is at this point a highly contagious infectious disease. So in the early stages of coronavirus, this was classified as what we call a HCID, a high consequence infectious disease. So it's all become now about what can we do to make the hospitals ready for this, the unknown. It was a tweet I put out into social media through which 3 partners in our communities immediately responded. One was BAE, another was Lancaster University, and the third was actually the school right next door to the hospital here in Lancaster called Ripper St Thomas, who all immediately set about generating 3D laser printed curtain hooks. And from there, the relationship grows. And several weeks later, an ask of BAE, we knew that we were short of beds on the modelling that we had to say that we could at peak, before the very first lockdown, require an extra 250 beds for what we thought was the patient load coming into the hospital. And fabulously, colleagues from BAE stepped forward and their partners, their supply chain stepped in as well. And within 10 days, we made 197 out of hospital, what we call recovery beds from scratch. One was based in Barrow at the Furness Academy school site, and the other was in the Kendall Leisure Centre. But that was 10 days worth of effort to deliver. And I'm proud to say we never used them because actually things such as the lockdown worked, but it nevertheless set about this relationship where, from my perspective, I had a really good go-to partner that I knew when I had a really big challenge I could reach into, and they were there as our friend and as our partner. But also as well, from my point of view, Morecambe Bay is a community. It feels very much like a community. We all live together, we all work together, and there are people in the hospital, not people in BAE. I myself live in Halton in Lancaster, which is where Neville and his company is based. I drink in the same social club as some of his team. So it really felt familial. And then the last bullet point there is the Morecambe Bay Scrubs. And again, this comes about from a community-led initiative whereby a group of ladies, and in actual fact it was over 200 of them, came together to say, we will sew scrubs. Because you'll be surprised, in the very first wave of the pandemic, everybody wanted theatre scrubs, and we couldn't buy them for love nor money. So Neville volunteered his business at that time to help cut the fabric, and then these ladies in their own homes were sewing the scrubs and handing them over to the hospital. So we really saw a huge community effort in that very first wave of COVID, and that sets about these relationships from which we go forward. So next slide, please. Back one. You will have seen some really horrific pictures in social media during the course of the last 12 months. And it is fair to say that PPE has been challenging in terms of its supply, its quality, its suitability, and we were no different to anywhere else. And then, as you can see from the top picture there, clinical colleagues were wearing pieces of PPE that were industrially correct. They met the relevant legislative standards, but we've never had practice of wearing them for extended periods of time. A lot of the PPE is designed around the industrial application, and it's designed around the 95th percentile male. Well, the NHS is about 70–75% female, so automatically you're looking at a range of PPE available that won't fit your workforce. And we also saw some unique examples of colleagues from BAME backgrounds for whom their facial shape doesn't lend itself to the wearing of PPE. And finally, as you can see in the bottom picture there, the extended wear of this PPE was causing some really horrific facial injuries to colleagues. Lots of pressure sores, and as you can see there, that is a thoroughly unpleasant way to live when you're a clinician, but they did live it because their duty was to their patients. So I knew we had to do something at this point to try and make their life better. Next slide. So we reached out into the commercial world and said, right, what is it we could buy? And there are these systems called PAPR systems, so powered air purifying respirator. And they work, as you can see in the picture there, by sucking air through a filter and delivering it through a connecting hose into a helmet-worn hood. Again, those are industrially designed pieces of PPE. They do meet the health and safety executive standards that we were required to wear at the time. They were meeting the filtration standards as was decided for us by the Public Health England's scientists. But again, not adequately designed for healthcare purposes. They met a safety standard, but clearly, as you can see, they were cumbersome, they were noisy, again designed around male wearers, not females, ideally suited for things such as welding, grinding, industrial type activity, as opposed to healthcare. But we also saw PPE costs astronomically shoot up through the roof. And in some cases, they were well above a 500% increase in price. And to give you an example, a simple Type 2R disposable, what you would all know as a surgical mask, pre-pandemic was 17 pence each. At the peak of the pandemic last year, each one of those was £5.95. So the cost to the NHS, the cost to the society, and bearing in mind that's a cost to us, because we're all taxpayers, goes absolutely through the roof. So we found a product. We wanted to buy 1,500 of them. The aim being is that we would give every frontline member of staff their own personal issue hood, because we know it's safer, it's more comfortable, etc. But because of the pandemic buying that was going on at the time, we only managed to buy 98. So I haven't even got 1/15 of the amount of PPE that I now want at this point. Next slide, please. So me being me, decided to break all the norms, all the rules, and seek forgiveness afterwards. Was around, let's reach out to these partners who up until now have been absolutely great in helping us cope with this pandemic. And as you can see there, the Morecambe Bay Hood really is about Morecambe Bay. So on our farthest side of our trust footprint is Barrow in Furness, and BAE Systems are based there. As a hospital trust, we have hospitals based in Barrow, in Ulverston, in Kendal, in Morecambe, and in Lancaster. And then through the Morecambe Bay Scrubs team, we were introduced to Neville and his team, who are based in Holton, which is a little village about 3 miles away from the hospital here in Lancaster, called Lancastle. And we got together with a really good brief at the time, from my perspective, which is I wanted it to be locally designed and manufactured. We talk about the NHS being an anchor institution and the Morecambe Bay pound. And we've all seen the potential impact of this pandemic on our communities and on our economics. So for me, it was about what I could do to support our communities with their economic recovery by ensuring as much as possible we were going to spend money here within our community. And Morecambe Bay as a trust has 1,000 square mile footprint. And we've got some really good innovative minds in our region. We've got some really good manufacturing businesses, really good design businesses, and I wanted to make the most of that. I knew that in the run-up to where we were, PPE coming from overseas was almost impossible to source. So a constraint that I did put on the team then was that nothing on this PPE was to come from outside of the UK, and as much as possible from within Morecambe Bay. And the last bullet point there was that I really set a stipulation of this wasn't about, in the future, commercial companies having the ability to strong-arm the NHS by saying, well, you might have paid A yesterday, but today it's B, possibly C, and in some cases, all the way through to Z. So that was what we set about doing. And then final slide, please. We did it. So it took us 20 weeks. We met every Thursday at Lancastle in the middle of the pandemic. We were socially distanced. Invariably, we were in the garden at the back. And very much like a Blue Peter type initiative, and this is where I'm sure Michael and Paul will come in with how it felt for them, but I knew what I wanted to achieve, I just didn't know how to do it. So we were trial and error through those weeks. Neville's team, absolutely amazing with regard to knowledge about fabrics and sewing. Julie in particular from Neville's team would come out, pen, pair of scissors, what do you want? And 15, 20 minutes later had run up a sample for us. And it was that fabulous an experience to go through, that this was bright minds coming together. Everybody was an equal. Nobody had a voice bigger than anybody else. And 20 weeks, we'd gone from a concept to a solution, which we then put in for certification. And we got the certification. The hood is now deployed. The picture that you can see there is actually, again, where BAE brought some really excellent support to the project. We did some human factors trials. So we actually listened to the voice of the clinicians by saying, right, this is a piece of PPE that we've designed for you. Play with it, tell us what you think. And you might just be able to see the colleague on the very right-hand side of the picture there has a smile on their face. And then simple things such as the ability to communicate. When your face is covered fully and all the patient can see is a pair of eyes. As healthcare professionals, that's really hard. And particularly when we know those patients are sadly going to die, to not have those visual cues that we all rely upon is really hard. And a lot of our clinicians did find it very stressful. And we know from some of our patients, for those who survived, they found it very inhuman. And for some of our patients, they require the ability to read people's lips in order to communicate. So the hood itself was really opened up an opportunity for staff to work better. They feel safer in the hood. The endurance of the hood is much greater than a disposable product. From a green perspective, it's reusable, so we're reducing the amount of waste going to incineration or landfill. And for the patient, they have the ability to see more clearly those people who are caring for them. So I think I want to leave sort of my bit there and invite questions and a commentary from other participants really around what we've achieved, really, because it is unique from my perspective.
Thank you for that, Stuart. That's fascinating. Can I just ask a question about the relationship? So essentially, From what you were saying, you and Neville went to the pub together, so you already knew each other. Was that where that relationship came from, or was it slightly more, I suppose, strategic than that? And how was the relationship made with BAE as well? Those initial conversations.
So the initial introduction was with BAE, and actually it's with Derek, who's on this conversation with us today. Derek is our materials guru. What Derek doesn't know about building something isn't worth knowing. So Derek, in his garage at the height of the pandemic, so it was quite surreal. BAE responded to a tweet: "We can help you with ink. Can you give us a sample?" So I drove all the way to Ulverston, down this country lane, and I handed Derek one hook over the garden wall as if we were socially distanced, and from there we go into production of hooks. Fast forward 4 weeks, I need some recovery centre beds. So I reach back into BAE and say, "Help, I've got a problem, what can you do?" BAE do that one. And then running in parallel is the Morecambe Bay Scrubs, which is the women who worked out of the community centre in Halton. And it was one of that team who then made the introduction with Neville. And I have to say, our first meeting with Neville potentially could have been an absolute disaster, because I set about destroying a commentary about a certain piece of PPE, which Neville will never let me forget. But then Neville said, "Oh, we make that here." And foot out of mouth later, we've developed a good working relationship and a good friendship, and that's how it comes about. So it was an interesting
example though of industrial PPE and your views of it in relation to clinical purposes. Yeah. So nothing wrong with the product itself, just the wrong context.
Explain that to me. Wrong context.
Yeah, by all means. This was something that we sort of concluded very early in this particular project. In fact, you know, the context of PPE of a certain category or a certain classification being suitable for different environments. And obviously within the clinical environment, it's quite unique. It's extremely human oriented in terms of the people that you interact with when you're wearing it. So if you were wearing PPE in a factory, then being able to communicate facially may not be so important. But wearing PPE in a clinical environment, being able to convey a sense of empathy to your patients, for me personally, that was one of the real light bulb moments in this particular project, that it wasn't that in the correct context there was anything particularly wrong with any of the PPE being used. It was just applying the clinical context, especially in situations where healthcare workers were dealing with obviously extremely poorly, extremely sick patients, some very close to the end of their life, so many sadly passing away. Then the ability to communicate facially a sense of empathy was not only very important for the patients, but it was enormously important as well to the healthcare workers. And it was very clear when we first started engaging with them just how stressful they were finding the experience of not being able to convey the very significant amounts of care that they had in their patients. So having a visor, for example, as big as possible was a really big, important feature of the end solution.
So suddenly you found that the spec for the design of this piece of kit was not entirely based just on safety. It was actually as important that it fulfilled that, and not even just clinical, that caring capacity to, so it actually probably had as bigger impact on mental health as it did on physical health to some extent, enabling healthcare staff to actually do their jobs properly as they would perceive that. Yeah.
Yeah, and I think when we did the human factors trials, the clinicians were really clear that they felt safer in the hood. Now, from a human factors perspective, that psychological condition is really, really crucial, because if you feel safer, you are less stressed. If you are less stressed, the wearing of this PPE for 4, 5, 6, 7, or even 8 hours continuously will not fatigue you the same way as if you're worried about, is this mask still fitting my face? Is it protecting me? All those anxiety points where we know that the more stressed you are, the greater the likelihood is of a human error creeping in. And in our case, in healthcare, that human error equals harm.
Yeah. Did you find on that same note then that there were any compromises between, so you've got two factors there. You've got a physical health factor, and you have a kind of emotional, mental factor, specification for that piece of kit. It's got to work properly, but it's also got to facilitate care, communication, expression. Were there any points where there was a compromise in that design with any of the safety factors, or you know, there was no compromise, there were no legislative constraints that you had to overcome innovatively? Yeah,
so there are prescribed standards for a powered air purifying respirator. And again, this is where BAE's team and its scale and its capability comes in absolutely essential. There are engineers who pored over those specifications and understood it far better than I could do as a mere head of patient flow in the NHS, and therefore were able to advise us. We got some great support from the NHS Innovation Agency, and even the HSE stepped forward to advise and guide us around. They could see this was a national imperative, that we had to find something that was different but was able to meet the relevant standard. The testing that we went through, one of the key tests is called the total inward leakage test. So this measures the amount of air that can come into that hood. And the standard says is that you're allowed to have 2% leakage. The hood itself is measured in 0.00 and beyond. That's how good a design it is. So we know it's safe, we know it meets the standard, and our colleagues who are wearing it now are really telling us the difference this is making to them and their ability to care for patients. And that's what it's about. And hopefully, it's not just about application in the hospital. We could see this being used in the community with ambulance colleagues, with dental colleagues. This is about getting our NHS services back up and running. And from a recent meeting that we all had with members from NHS England, there's an estimation currently that there are 70,000 clinicians in the UK today who don't fit any of the available disposable PPE products. But they are not working clinically. Because there's no one design that fits everybody. There isn't a universal design. Whereas the hood itself, because it doesn't need to be fitted to the individual, has the ability to be that game changer. So we could put each one of those clinicians into a hood and they'd be back at work tomorrow delivering care. And as you've seen in the news, the growing waiting list problem that we've got at the minute, we've got to get these clinical colleagues back into the workplace.
Yeah, absolutely. I have quite a lot of clients that work in the construction sector, and the women that are in that sector are constantly saying that, you know, if I'm 5'0", my PP, I'm walking around in these high vis jackets that are down to my knees. It's you know, so it's that application is much wider than just health as well, isn't it? This recognition that actually one size doesn't fit all. Sorry, Michael, did you have your hand up?
Yeah, sorry, it was just in response to your question about trade-offs. The way in which BAE Systems approaches sort of design activities is to try and not only understand the outcome, and the NHS, very interestingly for us, is obviously a very outcome-focused organisation, but we also create a set of requirements in terms of what we need to achieve. And by having such close collaboration with the clinicians during the development of this, we were able to focus on the principal attributes of what we needed to solve and what the outcome was that we needed to reach. And by doing so, we were able to address certain aspects of this, such as the challenge of fitting so many different shapes and sizes and circumstances that all of the wearers would have, whether they had facial hair or wore glasses, whether they were male or female. And it was that focus on satisfying a set of requirements that led to a defined outcome that meant that we were able to develop something that was quite novel and rely on a neck seal, for example, in order to achieve the universal fit, rather than a face seal, where obviously everybody has got very different shaped faces, as we all know. So I would say that obviously any good design is about balance, but it's also very much about listening to what the outcome needs to be and collaborating along the way. And by systematically sort of trying to decant that into its constituent parts, we were able to make sure that there weren't those sorts of trade-offs that you just referred to, and hence the solution that we were very pleased to pass through certification on its first attempt.
Cool. I have another question, and it's around resource as well. So suddenly, you guys got very involved in a brand new thing that is nothing to do with submarines or other stuff that BAE does, or does Lancastle do? So how did you have any resource constraints? How did you manage to do this so fast and give the time to it? So that's a question to both BAE and Lancastle, really. How did you respond to that need?
Yeah, I mean, from a Lancastle perspective, this is a very big project for us as an SME. The answer to your question of how did we cope was a combination of really getting the benefit of the depth of resource that's available through the collaboration with BAE and the NHS, because there is a depth of resource there that we as an SME don't have. Coupled with that, just an enthusiasm from within our entire team. Everybody inside our team has had some input into the design of this hood and the elements that we brought to the collaboration. And then a common theme, I think, throughout is some very early mornings and very late nights from every member of the project team.
From BAE's point of view, the project team that's been working full-time on this for the months that the project span was about half a dozen people, and they were supported by about 35 people during the course of the project who brought their skills to bear during a certain period to contribute. I think the BAE has found it an enormous privilege to be able to help the NHS at a time like this. And I think from a very personal point of view, it's been quite amazing for us individually to see that we haven't been pushing against anything here. We've had support from our chief executive right down to the project. Each step of the way, when we've asked for something, it's been there. And we all hope to work for an organisation during our careers that steps in like that when there's a real need. And it was an emergency situation. And for us, starting, as Stuart said, handing a single curtain hook over the garden fence to Derek Scholes, our technologist, on the Monday, for us to be able to deliver curtain hooks on the Tuesday, and for them to be in the wards on the Wednesday, that led to a sort of a degree of momentum regarding trust. And I think it's been each individual in the project has put everything into it, but it's also been very much about shared values, and especially to be trusted with something so important at such an important moment. That has meant the world to not only the people involved in the project, but to our organisations as well, who've really helped us every single step of the way.
And when you talk about resources, the NHS doesn't make anything like this at all. So I've had the most amazing experience working with some professionals who, in my other day job, I would never ever have had. So people like Derek who know everything about materials, Neville and fabric. I mean, the fabric that we've got on this hood has been made specifically for this hood. From an infection control perspective, Derek found a solution that kept our infection control colleagues happy, because the material is cleanable with all our approved cleaning products in the NHS. From noise and vibration to engineers, we can't really show you on the screen, but there is some really unique innovation in the air distribution inside the hood, which makes it significantly quieter, which again aids communication. A human factors team, again, we don't have that in the NHS, but to be able to give our clinical colleagues an opportunity to field test this product and to have some real science behind it is absolutely amazing. So yeah, I can't speak highly enough of the partners on this, but it does show the value of reaching out into our communities. Don't be afraid to ask the question and say, can somebody help us? We've got a problem. And in this particular case, boy, did we come up trumps.
So my next question, just leading on from that, is we talk a lot within the whole supply chain conversations that we have, and about localism, about the differences between big businesses and small businesses, and the fact that often the two find it difficult to work together because of different working practices. Neville, what were your experiences of working very quickly with two very, very large organisations? And were there teething problems? Did everybody start to work in different ways to facilitate this?
I would say actually from day one of the project, we've all approached this with a shared value. And that was driven by the original brief that Stuart came and gave to us all. Very, very clear of, he knew what he wanted. And our job then was to deliver that. There was no clashes of ego between large organisation and small, or the other way around. I think it's fair to say everybody left their business card at the door when they walked in. And as Stuart mentioned earlier, a lot of this development work was done. We have a courtyard at the back of our factory, and we did a lot of the development work outside in the open, so we could maintain social distancing, because at that time we had to maintain all of that. even running a project such as this whilst maintaining social distancing took some doing, but we did it by operating outside most of the time, and there was no clash of culture at all, because everyone left their job title at the door when they walked through, and we stood around the table with one shared value, one common aim, and one goal in mind, and that's all we focused on.
That's cool. Do you think if there had not been a pandemic going on, that this collaboration could have happened?
I think this collaboration is very rooted in the circumstances at the time, and as well as for example, BAE Systems being a very large organisation, it is a very human organisation in terms of its commitment to its local communities, and we've got a lot of contacts with our local communities wherever our sites are. I think in terms of the DNA of the people involved, it has been a very compatible collaboration, because everybody has done it for entirely altruistic reasons. There was plenty of reasons to do nothing and sit tight and wait for other people to fix problems. But I think the organisations involved are far more active and committed to society than that. And the reason that the individuals and the organisations have stepped in is because the NHS asked them to. And with the experience that I've personally had in the last 18 months or so, it has been people responding and organisations responding to the circumstances that are there. There is plenty of collaboration that takes place between the large organisation and business units of BAE Systems and SMEs. There's a lot of support just day to day that takes place. But in a situation such as this, working with an organisation, for example, the NHS, but also Lancastle, I think when organisations are brought together that do share similar values, working together, irrespective of size, is entirely possible and often very successful.
I think from my perspective, the pandemic highlights, as a resilience professional, some gaps that we had in our assumptions and how fragile supply chains turned out to be when you put them under a global test. Mm-hmm. So that was one of the reasons why we went for the localism, which is we had to be reliant within our communities, because there was nobody else coming charging over the hill in our direction. And from my perspective, working in healthcare, it's my friends, it's my family that are wearing that PPE. But equally for all of us on the project, it could have been any one of us in a hospital bed needing that care as well. And I think without the pandemic, there would have been no reason for the three organisations to ever make contact with each other, because it just wasn't there. But I think what it has really evidently shown to us as a trust is we need to do more now with our local partners. And one of the initiatives I'm working on at the moment with localism is around how do we make NHS facilities available out of hours for community groups to use. For example, we've got an education centre that sits there empty after 5 o'clock in an evening till 8 o'clock the following morning and Saturday and Sunday. Why isn't that being more widely used? So I think one of the great things that will come from this pandemic in terms of Morecambe Bay is that spider network that's now developing into our community to say, how do we work better together, and to sort of break down those traditional why wouldn't we reach into a local business that's 3 miles away from the front door of the hospital to talk about materials? We use scrubs day in, day out. Why aren't we buying local? Why are we reliant on buying scrubs from Romania, for example? And it's really challenging a lot of those procurement assumptions and things that were happening pre-pandemic. And I hope to God that it stays that way.
So have you got a plan, Stuart, of how you take that learning, this learning from this wonderful project, and institutionalize essentially that learning? Because that's what you're talking about, isn't it? This not being a one-off, and this being a norm, this becoming a cultural thing within your organisation and other organisations that says we look first to local supply, we look to support our local companies, we look to maximise those opportunities for community benefit. Is that something that you will take forward in a structured way?
Yeah, so there is now a programme running in the Trust headed by our Director of Corporate Affairs to do exactly that. So our procurement teams, for example, very heavily governed by EU procurement rules around how we bought, but there are ways around those rules, and particularly with Brexit, gives a great opportunity to actually say, and from my point of view as a resilience, we've got to be much more robust in future at testing assumptions about supply chain. And that just because something on the face of it seems cheaper doesn't make it better in terms of resilience, because as we've proven during the pandemic, whilst we could buy masks at 17 pence each from China, when there's no international trade or travel, that contract's worthless. So definitely, and also around supporting the economic recovery of our communities. We know people have suffered greatly, both health-wise and economically, as a result of this pandemic. So as an anchor institution, it is incumbent on us to do something to support the recovery of our communities. So you will see more local buying and certainly more testing of local resilience around, actually, we might pay 10% on top of previous, but does that guarantee us supply in the event of a future something, shall we say, whatever it may be? Because this won't be a one-off pandemic.
And it's shifting those business decisions, isn't it? It's shifting those business considerations, and that's, you know, from our perspective, that's what social value is about. Social value is a specific methodology which came into practice as of the 1st of January this year that said all governmental organisations in scope of the Social Value Act must now consider social value, and this is what we're looking at. You know, those integral parts around social value are local supply chain, diverse supply chain, involvement with the third sector, the BCSE charity sector. So there are all those things that we're talking about, and the idea is that we now have a mechanism to be, and it's almost like it's the argument, isn't it? It's like, oh, we have to do this now, and it helps us change that culture. So I think, you know, I think for me, I've got, you know, my last question probably is, apart from the fact, aside from the fact that you created this amazing thing, and it is amazing, you know, it's life altering for people, isn't it? What were the best bits of the project for you, aside from the actual product itself? What did you particularly enjoy and feel that you benefited from most?
I'll let the guys answer first.
Okay. May I invite my colleague Paul Douglas to speak to this one first? I've done a lot of talking so far, and I've not invited Paul to participate, but I'll say something after Paul has, if that's okay.
I think there are quite a lot of things that are not immediately obvious and apparent. Obviously, helping the community and sort of wider sort of people in the area. I learned an awful lot from the project management perspective of things that I didn't appreciate in the past. So the setting of particular goals, and then using stakeholder management to actually get those goals out to people in a particular manner, is important, because if what you could say to somebody in the shipyard and tell them to do a particular thing by a particular date doesn't ring true for everybody. So when we were doing the human factors trials, it was very important for using your skill sets in a slightly different way. Try not to speak too much, listen really, really hard, and then try and translate that into something that everybody can understand. Medical world is full of jargonese, so is shipbuilding and defence. So poor Neville sometimes just sat there looking a bit bemused, as if to say, can you translate that into English, please? So it's more than just what's immediately apparent on the top. People have got deadlines. Some people think they know what deadlines mean. Some people think they understand exactly what requirements are for particular things. But it's not until you actually test these things across a range of stakeholders and learn to try to create a use case for each individual problem that you've got, which is understandable by everybody. That's when the real challenge came in then. And I personally now, in day-to-day work, draw back on some of the things that I benefited from a communications perspective, and I write things what I consider to be much more clearly now, because I get less emails back asking me to clarify certain points. So that's been rolled out in the shipyard. So through the charitable action that the shipyard did, they are actually gaining benefit from that investment that they put in, because engineering is now doing some of their requirements capture a little better. The articulation of it amongst all of the people that are involved in it is the requirements and the use cases are more clearly understood, which then means we actually do things more efficiently and effectively and tend to get things right slightly more than first time now. It's those broader benefits, and I think that's what I'll take away from this, plus the benefit of working with the other two teams, which has been absolutely fantastic.
Thank you. Anyone else?
My own personal sort of highlights in terms of what I take away from this is that there have been two distinct moments for me that will really stay with me. When we designed and constructed with our the other people concerned the COVID recovery centres, and we took the clinical assessment team around to inspect that, and a couple of them actually started to cry because they couldn't believe that an organisation would step in and charitably help in this way. Similarly, when we completed our human factors trials on the Hood, with spending a week with clinicians, doing all sorts of monitoring them, doing all sorts of clinical activities. During a couple of those wash-up sessions at the end of those trials, some of the clinicians who were working in very frontline positions, either in A&E or in respiratory aerosol generating procedure teams, they also cried because they were so relieved that there was such a sense of community, national as well as local, in terms of companies stepping forward to help in this way. And for me, I have the great privilege of working for one of those companies and being part of this project. But that is considered clearly, demonstrably, it's exceptional in terms of this sort of help. I don't feel that it should be exceptional in terms of those that can stepping forward and stepping up at a time of need. I'm lucky to work for BAE Systems, who's been prepared to step up in this way during this emergency. But if other organisations were to do so similarly, then we'd have a much more decisive national effort in terms of fixing some of the underlying problems. And by big companies working with smaller companies, where it is quite possible to knit it together and come up with something quite special in quite a short period of time.
Yeah, well said. Yeah.
Going back to your original question, which I think was, what's the best bit, apart from the finished product, obviously. Really, from our point of view, it has and remains an absolute privilege to be part of this project, not just because of what we have ultimately produced, of which something we're all very proud. I think we will all agree on that. We're all very proud of that, but it's been a privilege because we've all come together. We've all brought shared values to the project, and it's, as an SME dealing with such large organisations as the NHS and BAE Systems, it's actually humanised those organisations as far as we're concerned. Everyone's heard of BAE Systems and everyone's heard of the NHS, and it's easy to think of them as entities, but they're not. They're organisations made up of highly motivated, highly impressive people, and it's humanised those organisations, and that has been a huge takeaway.
Yeah, I think that's it. Yeah, it's easy. It's easy to become slightly anonymized, isn't it, in large organizations, and you fall into your functions rather than being human beings, and it's lovely when there is that opportunity for people to be human beings as well. So anything for you, Stuart, as a last word?
I think there's two great moments for me in all of this. I think the first one is from within the trust. I've proven that we can do this in terms of that social innovation. That as a trailblazer, we're now internally seen as the go-to team to say, well, they did it, why can't you? And I think that's really good, because people are naturally competitive and people hate being second and things like that. So if it brings about more social innovation, then I've done some good for the NHS and for Morecambe Bay. And I think the last thing for me is I've made some new friends. And I think that's the enduring thing now, is we'll go for a pint together, we have a laugh and a joke. And yeah, it's great to have people from different backgrounds, different organisations, but to show the true strength of human spirit and grit when we're up against it. Great Britain is still Great Britain.
Thank you. Yeah, so thank you all of you for speaking, and I hope that everybody who joined us found this as interesting as I did. I just think it's a brilliant project. Well done, just so well done. I'm sure you've had people say that to you over and over again, but it's truly great. And I think that the great thing is the thought that this process is starting to change the way that we work and make us more receptive and enabled to work in these inclusive ways as we move forward. And I look forward to great things from the partnership in the future. So thank you very much, everybody, and thanks for joining us. Goodbye.
Great.
Thank you.
Thank you.
Thank you very much.